Hello everyone, this is Dr. Saroj Siddiqui from the platform of UKMLA with DSS, and let's just continue our UKMLA 2 success course. So today what we are going to do is that we are going to talk about the alcohol and drug dependence. Okay, so there would be a psychiatry case in PLAB 2 in which you would have to basically check the dependency of a patient on either alcohol or the patient may be doing some recreational drugs. Okay, so let's just go through that how this case would particularly present. Adam Smith or whatever the patient's name is, they would be coming to you in the clinic, and either they would have an intention to stop the recreational drug. Okay, that is one possibility, that they're here to get some help. They're here to seek some help to stop the recreational drug. Okay, or to stop alcohol, or there is a very strong possibility that this patient may be brought in by the wife or their relative or their mother, and they would be concerned about them having chronic alcohol habits and habit of doing recreational drug, and the mother or the wife would want the patient to stop taking the recreational drug. Okay, so these are the like two variants of how this case presents. Okay, and it can be the dependency on either alcohol or any recreational drug. Okay, so the basic structure for either alcohol or for the drug, it's the same. Okay, but when it comes to the management point and when it comes to the important things that you should be aware of, it's a lot of different things that you need to have in your mind. So we're going to discuss that after we are done with the structure. Okay, so let's just go with the very first layer, okay, of checking drug dependency and checking alcohol dependency. Number one, you need to explore the alcohol and you need to explore the drug itself. Okay, and there are a bunch of questions that you need to ask. Okay, and you make sure that you are asking all of them. You cannot just touch upon the aspect of it and then just move on, but make sure that you're done with asking all of these questions that are mentioned over here. Okay, number one, uh, which alcohol do you take or which drug do you take? Which alcohol would mean that is it a beer, is it a wine, okay, is it red wine, okay, like is it a local alcohol that the patient is taking, and which drugs are you taking? Is it ecstasy, is it opioids? Okay, so is it LSD? So like there are multiple type of drugs and different type of alcohol that the patient may be taking. Okay, so you got to ask about what type of substance they are abusing. All right, then the quantity. But can you please tell me how much alcohol do you take? Yeah, doctor, I drink 2 bottles of wine every day. Yeah, doctor, I drink 7 cans of beer every day. Yeah, doctor, I take let's say XYZ gram of opioid every day. Okay, so you need to ask about the quantity as well. Then very important question, where do you get it from? Okay, like is it being provided by a friend? Is it being provided from some illegal sources? Okay, so you need to get the idea of that, where are they getting it from. All right, number three, then why did you start it in the very first place? Okay, and this is a very important question because this will help you very much in your management, because maybe the patient is going through some financial stresses, maybe the patient had a traumatic life experience, maybe the patient is undergoing depression. Okay, so you need to get to the root cause of it. You need to understand why this patient is so much dependent on alcohol or so much dependent on a particular drug, because if you treat the root cause, you would automatically reduce his or her habit of taking recreational drugs or taking chronic alcohol. All right, so why did this start? Okay, very important question that needs to be asked. You cannot just miss this question. Okay, then the chronic alcoholics and specifically the people who are doing recreational drugs, they usually get caught by the police for legal issues, because number one, they're getting the drugs from illegal sources. Number two, when they're under the influence of the recreational drugs, they may end up violating some rules. Number three, they're usually living on the streets, living as homeless. Okay, which is not very much legally allowed in, to sit somewhere at public places. Okay, they're not legally allowed to do that, and they end up, creating public violence and all. So you need to have that particular aspect in mind, and then you need to ask whether or not they get caught by the police for any legal issues. Okay, then very important thing, and this is a question that is particularly for the drug abuse, okay, and not for the alcohol abuse, that by any chance do you share needles? Okay, because the IV drug abusers, okay, they are doing drugs through the veins, and they often don't have that many needles, and like what happens is that they end up sharing the needles, like a bunch of people who are doing drugs, they just use one particular needle and then they just inject the drug using that needle. Okay, so you got to ask about that, and then there is a follow-up question with that, that are you aware of the needle exchange program? Okay, I'm going to talk about what the needle exchange program is in a while, after I'm done with the teaching the structure. Okay, so always remember that needle exchange program question needs to be asked. So I'll just give you a hint about what it is. So needle exchange program is basically a program that is initiated by the NHS, in which the IV drug abusers who are trying to quit, and who are making some efforts to quit the habit of taking IV drugs, what they can do is that they can go to the needle exchange program. They can deposit the old and the used needles, and they can get the new needles. Okay, so this is not basically promoting IV drug abuse, and that is why I said in the beginning that it is for those who are actually trying to, cut down the habits. Okay, those people are preferred, but this is a step that is taken to reduce the risk of transmitted diseases like hepatitis B, C, and HIV. Okay, because the burden of HIV, Hep B, and Hep C is way more in the in the UK, as compared to the number of people who are doing the IV drugs, and the issues that are caused by the people who are taking IV drugs. So that is why we have the needle exchange program in the UK, where you can get the needles and you can get it replaced. You can get safer needles. Okay, so it may seem that okay, NHS is promoting IV drug abuse, but that's not the case. The main reason behind it is to reduce the burden of HIV, hepatitis B, and hepatitis C, because its treatment causes a lot of financial burden on the NHS. Okay, so this is a cheaper alternative. All right. And then the last question that you may ask about that, okay, by any chance do you take any other substance? Okay, like let's suppose somebody started talking about opioid, somebody started talking about LSD, maybe they are also taking ecstasy, maybe they are taking like any other drug, okay, that they may have not talked about earlier on. All right, so these 7 to 8 questions, like it would give you a very comprehensive and a very detailed idea on what the drug is, and how much drug they are taking, how they are taking it. Okay, so the what, when, how, why of the drug is something that you would have to explore in the very first layer. Okay, and it is going to be a detailed conversation because there is a lot of information that you're trying to extract from the patient. All right, so that is the very first layer of the drug dependency, like scenarios, or the drug dependency cases. Okay, then the most important layer, okay, that is something called the cornerstone of the drug dependency case. Okay, as you can see in the task, that you have to assess the patient for drug dependency. Okay, and this KHTW, okay, this is what the mnemonic is. This is what the bunch of question is that will help you check whether or not a patient is highly dependent on alcohol, or whether or not a patient is highly dependent on a particular drug. Okay, so what is KHTW? C stands for cut down. Okay, so and how you're going to ask that? Have you ever tried to cut down your intake of alcohol or your intake of drug? Okay, if they have tried to cut down, okay, that means that okay, all right, they've tried their best, that means they're not that dependent. Okay, because they're trying to cut it down. Okay, but if somebody is highly dependent on alcohol, or highly dependent on drugs, they would not even try to cut it down. They'll just keep on taking it. Okay, very important question that you need to ask. Then the A in the KHTW stands for annoyed. Okay, that do you get annoyed when somebody talks about your drinking habits, or somebody talks about your drug habits? Okay, if somebody is getting annoyed, that means that they're really dependent on it, because they don't want people to talk about it. They're like, just leave me alone, just leave me on my own. Okay, all I care about is, like the drugs. Okay, so you need to ask this, anybody, if anyone talks about your habit, do you get annoyed? All right, very important. Then, do you feel guilty after taking the drug? Okay, the G stands for the guilty. Okay, if somebody's feeling guilty after taking the drug, that means they're not that dependent. Okay, so important point. Then the E in the KCW is stands for, do you need the alcohol or the drug to open your eyes and do your task in the morning? That means that, is that alcohol and is that particular drug the first thing that you need in the morning? Otherwise, you would not leave your bed. Okay, that shows that if somebody says yes to this, it shows that this patient is highly dependent on that particular drug, or highly dependent on alcohol. Okay, very important question. All right, then the T stands for tolerance. Okay, um, how are you going to ask about the tolerance part? That, do you feel that you need a higher amount of the drug or higher amount of the alcohol to achieve the same effect? All right, if the patient is constantly needing the higher amount of that particular drug or higher amount of alcohol to get the same effect that the patient was getting a few days back, that means the patient has developed tolerance. And if the tolerance is there, that means the patient is highly dependent on the alcohol, or highly dependent on the particular drug that the patient might be taking. Okay, so a very important question. Then, do you feel any withdrawal symptoms? Okay, the W stands for the withdrawal. That, do you feel any withdrawal symptoms such as tremors, anxiety, vomiting when you don't take the alcohol, when you don't take the drug? Okay, so these are the six questions. Okay, that you would help you tell that whether or not a patient is dependent on alcohol or not. Okay, and remember, your task was to check the dependency. Okay, your task was to basically check whether or not a particular patient is dependent on the drug, dependent on the alcohol. Okay, and you got to do all of these six questions. You got to ask all of these questions to make sure that, okay, uh, to check basically whether or not the dependency is there or not. Okay, very important thing. Another important thing, like I've been discussing the questions, but since it's a psychiatry station, okay, expect the patient to be in that defensive posture, and giving the non-verbal clues, and not being very comfortable in talking to you, because patients who are chronic alcoholic, chronic IV drug abusers, okay, they're not very confident, and they are not very open to conversations. Okay, and it's very difficult for you to make sure that they're comfortable and they're willing to talk. All right, so they would be in their defensive posture, they would be in their defensive mindset, defensive state. Okay, so you've got to make sure that you acknowledge that. Okay, and you got to make sure that you try to make them comfortable and try to make them open up. And like, along with the basics that you need to follow to open, to make the patient open up from the non-verbal clues, like for example, acknowledging that, okay, they are not feeling themselves, and then offering a safe space, and then offering confidentiality. Apart from that, one very important IPS tip that I want to give you is that, specifically, and this tip is for those people who are willing to cut down the alcohol. Okay, use the method of appreciation. Okay, that if somebody comes to you, you have read it in the task that, okay, this patient wants to cut down alcohol, this patient wants to stop taking the drug. Okay, so try to be appreciative, that, thank you so much for coming, Mr. Adam, I really appreciate the step that you took, or I really appreciate the initiative that you took to stop this habit. And I do understand that it takes a lot of courage and motivation to stop these habits. And I'm really happy to see that you have already done the difficult part, because the difficult part is just to make yourself agree that you need to stop this, and you've taken the first step, and you should be proud of what you have done. Since you are here, I'm going to try my best to help you in the best way possible, so that together we can help you achieve your target, and together we can help you get rid of this habit. Okay, be appreciative. Okay, and this is something that is going to really help you. Okay, use these terminologies like I really appreciate, number one. Then you need to say that it takes a lot of courage and motivation. Okay, to show that okay, the patient has the courage and the patient has the motivation to do that. Number one, I'm very proud of you. Your family would be very proud of you, so since you have decided to take this step. Okay, and we're going to try our best to help you in this particular regards. Okay, try to use this word, try to be as appreciative, and try to create that positive mindset that okay, he has done the right thing, and he's supported, and NHS is going to help this particular person, the doctor is going to help this particular person. Okay, so this will really help you, open up. All right, very important tip that I wanted to share. So this completes the second layer. Okay, now just move on to the third and the fourth layer, which is something that you're already aware of. We've been talking about the psychiatric aspect time and again, and we know that there are three things to the psychiatric aspect. Number one, the mood. Okay, now can you please tell me how is your mood on a scale of 1 to 10? Then you assess the harm, that okay, have you ever tried to harm yourself, because the patient who are IV drug abusers, they do tend to harm themselves, and then since under the influence of drug, they may hallucinate, and they may see or hear unusual things. So you want to explore the hallucinations as well. Okay, so all the three typical psychiatric aspects need to be explored in this particular layer. All right, it's very simple, not going into the details of it again. Okay, then the meftosa, it's quite straightforward. The medicines that the patient might be taking, or the past medical history, it may be important. Then family history. Okay, if somebody has a family history of having someone who have been under the influence of alcohol and under the influence of recreational drugs. Like let's suppose if I see my dad doing it, then I as a kid would get that thing in my head, and then when I grow up, it's a very strong chance that even I end up taking alcohol. It's a very strong chance that even I end up doing recreational drugs. Okay, so the family history of substance abuse, that becomes particularly important. Okay, and what is the most important thing is the social history. Okay, who is at home, specifically children. Okay, and this is a very important thing that you need to take care in mind, because you need to ask that okay, if there are any children at home, do you take the drugs or do you take alcohol in front of your child as well? Because if somebody is doing that, then that's a crime. Okay, you're not legally allowed to take any alcohol or take any drugs in front of child. Okay, if a drug abuse is being done in front of a child, then that raises the alarms, and that raises the bell that okay, the social services needs to be involved. Okay, and the safety of the children is like really important in these cases. Okay, and you have to inquire about that, whether or not okay, because of the influence of alcohol, because of the influence of the drug, how is their relationship with the child? Okay, are they abusive towards the child? Okay, are they harsh towards the child? Are they rude towards the child? Okay, you need to inquire about this aspect. Okay, and if you ever find that okay, there is a child at home, they're doing drugs in front of the child, or they may be harsh, or they may be abusive towards that particular child, then please make sure that you are asking this question, and please make sure that when it comes to the management part, you're involving the social services. Okay, it's a very important thing, because if you miss out on this, it would show that you're not a safe doctor, you're not thinking safely about the child that is there in this house. Okay, very important thing. Other than that, you can ask about that okay, if you got any friends and family. Okay, just to assess the support, because why not, it's a mental health condition. Okay, and this person would need support or something. Okay, then if you haven't asked about this question, that why did you start it in the first place? Okay, then you may ask it about in the anything else section, that any financial stressors, okay, any depressive episode that must have happened, any life incident that you would want to share about, okay, anything else that you would want to talk about, okay. Just an open-ended question in the end, wouldn't give any harm to your data gathering. All right. So this is what the structure is, and this is how you are going to, do your data gathering. This is how your question should be structured, and these are the aspects that you should be, considering, and you should be asking when it comes to your data gathering. All right. The most important of it is the first tool is, that is exploring the drug itself and the KHTW. Okay. Now let's just discuss a few important things, and some few important services that are provided by the NHS. Okay, that you would help you help you in your consultation, and the ones that you have to use. Okay, whenever you are verbalizing your management. Okay, now let's suppose if you're sitting in a GP clinic, okay, and somebody comes to you with the concern of wanting to quit alcohol, okay. So instead of just saying that okay, we are going to send you to the rehab, we are going to send you to the psychiatry, try to use the word alcohol cessation clinic, okay, because in the NHS there is an alcohol cessation clinic, which is a one-stop solution. Okay, they provide medical advices, they provide counseling, they provide advices on withdrawal management, okay, and the medication that would help prevent withdrawal. Then they've got different support groups on which they connect different people. Okay, so alcohol solution clinic is basically a one-stop solution. Okay, they will have counselors as well to change the way they think. They would provide psychosocial therapy as well. Okay, so all of those things that are needed for someone to cut down their habit of taking alcohol. Okay, that is something that would be provided by the alcohol session. Like as you can see, assessment, counseling, withdrawal management, and medication assisted treatment as well. Okay, so instead of just sending them to the rehab, okay, then I'm going to send you to the rehab, I'm going to send you to the psychologist, then I'm going to send you to the psychiatrist, and then I'm going to send you to the pharmacy to get some medications. Okay, instead of making the patient go here and there, just send them to one particular solution, the one stop solution. Okay, there is alcohol solution clinic. All right. Then for the chronic alcoholics, okay, you can refer the patient, and you can mention something called the drink line UK. Okay, the patient who are like so much into alcohol, if they just want to call, and if they want some guidance on alcohol related issues, okay, they can call the drink line. Okay, they can get some guidance on cutting down alcohol. Okay, and if they want any support, okay, they can be referred to the support groups as well. So drink line UK is specifically for the alcoholic, and it is the national alcohol helpline. Okay, so try to mention that. Okay, like whenever you are advising, whenever you are safety netting, okay, try to use these things, because it will give an impression that you are well aware of the answer system, you are well aware of the system that is there in the UK. All right, a very important thing. Okay, drink line and alcohol suggestion thing. um, Now, for the substance, okay, for the drug abuse, we have got the substance abuse and misuse clinic. There is a very strong possibility that your setting that is there in the case note, you may be sitting in the substance misuse clinic, or you may be sitting in the alcohol solution clinic. Okay, but if you're not sitting there, if you're just in the GP surgery, okay, you may refer the patient to the substance abuse and misuse clinic. Okay, and this is particularly for those people who are struggling with drug or alcohol dependency. Okay, they have got medical assessment, they do counseling. Okay, they gives you advice on reducing alcohol. Then they also do the detox program. Okay, they give you psychosocial therapy. They try to involve you in rehab programs, in different support groups, involve in physical activities. Okay, that will help you uh, get over the habit of taking drugs, and get over the habit of taking alcohol. So substance misuse and abuse clinic is also one of the very very important NHS service that you should be aware of, and you should be using this terminology in your consultation. Okay, this is going to take the level of your consultation from here to here, to be very honest. Okay, then I've been talking about the support groups again and again. Okay, like the support groups, like we have NHS has got support groups for everything. Okay, for emotional support, for alcohol cessation, for smoking cessation, for mental health, issues, for IV drug abuse. Okay, like it's basically a lot of people. Okay, they combine together. Okay, and they're connected with healthcare professionals, and they're connected with volunteers. That help them talk about their mental health issues, that help them talk about their concerns. Okay, and then they get involved in different activities, and together they try to help each other to get through a problem, whether it's a mental health issue, whether it's addiction recovery. Okay, whether it's some chronic illness. Okay, so the support group is basically, it's a pretty generalized thing. Okay, it's basically for anyone who is going through something or the other mentally. Okay, and there is a support group available for that. So you can connect them to the support group, where they'll find similar people having similar stories, and together all of them, along with the mentorship of a healthcare professional and different volunteers, together they will give them the advices to get over a particular issue and get over a particular problem. Okay, very important services. You should use this support group terminology for all chronic illnesses, for all type of psychiatric cases, for all type of addiction and drug dependence cases, even for the suicide person who is undergoing something or the other mentally. You can talk about the support groups. It's a very important and a very useful thing that you could say in your consultation. Okay, then the social service. Okay, I talked about the social services. Okay, it is basically provide specifically the care to the vulnerable group in the society, that is the children, and that is the elderly. Okay, and the people with disabilities as well. And why I have mentioned social services over here, because in the case where the drug abuse is being done in front of children's. Okay, you are expected to involve the social services to make sure that the child is completely all right. Okay, so you should be aware of the social services. Then in the last lecture I talked about the, not the last lecture, but basically the lecture of in which I talked about the depression, I talked about the Citizen Advisory Bureau, also known as the CAB. Okay, it's basically an independent charity that provides free, confidential and impartial advice on range of issues. Okay, and mainly they help with the financial guidance, and they also help with different social and legal issues as well. Okay, so if somebody has started taking alcohol because of some legal issues, or somebody have started taking IV drugs or because of some social issues or some financial issues. Okay, let's suppose that somebody is in debt. Okay, somebody have housing problems. Okay, somebody uh, is struggling to get healthcare. Then all of these issues would be addressed by the Citizen Advisory Bureau, specifically the financial issues. Okay, so always make sure that if the reason for starting the drug. Okay, that is this particular question, why did you start it in the first place. Okay, if it can be addressed by the Citizen Advisory Bureau, then always make sure that you try to involve the Citizen Advisory Bureau. Okay, and not just in the drug dependency case. This is something that is there for all the psychiatry cases. Okay, and all the cases where the patient may be struggling financially. All right, so keep that in mind. Okay, then the needle exchange program, I already talked about what the needle exchange program is earlier on. Okay, uh, if somebody is sharing the needles. Okay, if they're not aware of the needle exchange program. Okay, then do refer them to the needle exchange program, and do talk about it. That okay, you can go to the needle exchange program to get your needles exchanged and make sure that you get a clean needle. Okay, so very important thing, since we are talking about alcohol, and since we are discussing about the alcohol dependency, and somebody wanting to put down this particular habit. There's a very strong possibility that you may have to calculate. Okay, the alcohol, and you need to know that what amount of unit is acceptable in the UK. Okay, so if somebody is drinking up to 14 units per week, okay, that is considered acceptable. Okay, You would not call someone alcoholic or someone, as a chronic alcoholic or someone involved in alcoholism unless they are taking more than 14 units per week. Okay. And they're not going to tell you that, doctor, I'm taking 9 units per week, I'm taking 30 units per week, I'm taking 2 units per week. Okay. You would have to calculate it. Okay. Because what they're going to say, they're just going to say that, doctor, I'm taking 1 glass of wine every day, doctor, I'm drinking 2 cans of beer every day. Okay. So you should be aware of the calculation, that what does that mean. Okay. If somebody says that I'm drinking 1 bottle of wine every day, okay, so what that particular thing mean? If I'm drinking 1 bottle of alcohol every day, what does that mean? Okay. So for all type of alcohol, okay, if this is say 1 shot, okay, 1 shot is equals to 1 unit. Okay, that is something that you should be aware of. If someone says that, doctor, yeah, just take a couple of shots, that means they're taking 2 to 3 units. Okay. And if somebody says that, doctor, I drink one entire bottle of alcohol, that means that consuming 30 units. Okay. So you need to remember that for all type of wines or for all type of alcohol, 1 shot is equals to 1 unit and 1 bottle is equals to 30 units. Okay. And if somebody says that, doctor, I drink 1 bottle of wine on the weekend, that means automatically they are going way above the acceptable limit and they would be considered as chronic alcoholics. Okay. But there are a few different calculation as well. Like for example, somebody may say that, doctor, I just drink 1 glass of wine every day. Okay. That means that patient is taking 3 units of alcohol every day. That means in a week they are taking 21 units, which is again not acceptable, because 14 units per week is acceptable. Okay. And if somebody says, doctor, I drink 1 bottle of wine just on the weekends, that means it's just 9 units. Okay. If somebody's taking 1 bottle of wine on the weekend and just occasionally drinks on the weekend, that means it is automatically fine. Okay. For the beer, 1 can would be equal to 1 pint, and 1 pint would be equal to 3 units. Okay. So if somebody says that I just had 3 cans of beer this weekend, that means they've taken just 9 units of alcohol. Okay. So this is a pretty challenging and a pretty confusing calculation that you should have in your mind. Okay. And remember it, there is no other way to go about it. And they're not going to give you the units, doctor, I take 30 units, because the GMC examiner is basically expecting you to calculate it yourself. Okay. So make sure that you have this particular calculation in your mind, and you use this conversion to understand that whether the patient is drinking as per the acceptable limit or not. Okay. Now the last thing that you should be aware of, that how you're going to explain this situation. Okay. And again, since it's a dependency, okay, dependency is not a condition of the brain, it's a psychiatric condition. Okay. So you're going to say that from the chat that we have had and from the examination finding, you may be having a condition of the mind in which it becomes dependent on a substance to achieve its normal function. Okay. The mind is the organ. The dependency on a substance to achieve its normal function is the pathology. It's a pretty manageable condition, and we call this condition as drug dependence or alcohol dependence. Okay. Condition of the mind in which it becomes dependent on some substance to achieve its normal function. Okay. Very simple explanation. Okay. Do not go into a very long statements. Okay. And just kill your time for no good reason. Okay. So yeah, that is pretty much it for today's lecture about alcohol and drug dependency. I hope that I have cleared every confusion and everything in lots of detail. But if you still have a lot of questions, and still if you have anything you want to ask about, if you have got any queries, then drop them down in the comment box below, or reach out to us on our social media. I would love to address all your concerns. And if you want a personalized mock, scan the QR code for more details. And that's it. See you in the next lecture now.